Good evening, everyone. Thank you very much for joining us tonight. This is our third night in a row for country e-health assessments. The context behind this week-long set of webinars and review of e-health assessments is that the ASEAN, or the Association of Southeast Asian Nations, recently formed an e-health care technical working group. And this is the chaired right now by Dr. Eric Tayag from the Department of Health of the Philippines. And one of their activities is to look at what has been done in the past and then look forward also in the future of what can be done. And so as part of that process, AeHIN is supporting the ASEAN eHealth Technical Working Group by hosting these nightly webinars for this week on the review of the past assessments done through the World Health Organization Global Observatory for eHealth. And assessments were done in, I think, 2007, 2013, and 2015. So for some countries like Indonesia, they only have one for 2013. For some countries, they only have 2015. And for some countries, they have both. So the purpose of these nightly webinars is to look back at all of these assessments and provide some context so that after this week, the presenting countries who are also members of the Association of Southeast Asian Nations can come together and talk about what they can do as an assessment, as a group for 2021 moving forward. So this is just part one. Part two would be a discussions amongst the presenters later on what assessment system they will use moving forward. And then part three will be the actual ASEAN meeting, which will be more formal later on and will only involve the members of the ASEAN country nations. So the first night, Dr. Eric Tayag showed us the way how to do it. And then last night, we had Laos PDR, Dr. Teputon, and Dr. Bunchay presenting to us their assessments. And tonight, we have one of our senior core members of AeHIN and also with the Ministry of Health Malaysia, Dr. Fazila Aludin, to present the assessment for Malaysia.
Hello, everyone. Very good evening, and thank you for attending this session. So today is Malaysia's turn on the country e-health assessment, and this will be our survey that we did in 2015. Before that, for those who don't know me, I'm Fazila. I'm a Senior Deputy Director from the Planning Division, and I do a lot of work in e-health strategy and planning. And also lately in a lot of work in innovation. Before I start into the survey that we did for Malaysia, I would like to bring you to this WHO ITU model, which was published in 2012. These are some of the e-health, in fact, these are the 7 e-health components that was outlined in this paper, in this publication, in leadership and governance, strategy, investment, services, and so forth. So these are the areas which I think is very important for any countries to look at when we are talking about e-health. So, sorry, just 1 minute. So the Global Observatory for eHealth was actually launched in 2005 when the World Health Assembly adopted the resolution establishing an e-health strategy for WHO. This was resolution 58.28. And GOE is an initiative dedicated to the study of e-health, its evolution and impact on health in countries. And they combine the the model combined WHO coordination regional and also at the headquarters to monitor the development of e-health worldwide with an emphasis on individual countries. So there were 3 global surveys done on e-health, which was conducted. And in 2015, the survey had a special focus with the use of e-health in support of the UHC. So WHO plans to reactivate this survey, which was last done in 2015. And I think there was one done in 2013 and one done much earlier, which I'm not sure of the year. So now the upcoming survey, WHO is planning to measure the maturity level of eHealth in its members using the dynamic maturity model. And the last surveys, all the last three surveys included 6 components: the foundation, the legal framework, telehealth, EHR, e-learning, and also mHealth. So in 2015, there were 6 ASEAN member states who participated in this survey: Cambodia, Laos, Malaysia, Philippines, Singapore, and Vietnam. Thus, the newly formed ASEAN eHealth TWG, which is chaired by Philippines by Dr. Eric Tayak himself, agreed that all the ASEAN member states to take part in the next WHO survey. So, and why we thought this was important, because I think this survey can provide the government with data as benchmarks for eHealth development and support eHealth national planning. The ASEAN eHealth TWG is currently doing a review of the 2015 survey of the ASEAN member states. So today I'll be presenting to you what we did in 2015. I did not fill up this survey, but I've gone through it, and I will just go and show you the survey. So in 2015, this was what the country context was. Population of 29 million. Today we have about 32 million with GNI per capita, and also the physician density, the nurse and midwife density is all shown here. And the life expectancy at birth was 74, which has not changed much. There's slight increase. Total health expenditure is also has slightly increased, but still less than 5%. And ICT development index rank was 59. Of course, our mobile cellular subscription is very, very high, and it is still above 100% today. Internet users, and in terms of percentage of the population, was 65 back then in 2015, but today I think we are almost reaching more than 75%. Like mentioned earlier, there are 6 components to this survey. So for the first component, which is the foundation, if you see the first column, country response, we responded almost yes to everything. And where we are in terms of the global yes is also here. So we had a lot of eHealth policy and strategy, HRS policy, and of course our funding was public funding. And the private and commercial funding was also available. We had 1 or 2 projects back then with a public-private partnership. And multilingual systems in eHealth was there. And also in terms of health, the students' pre-service training and in-service training was there. In the second component, again, there's a lot of yes here. But some of it, I think, because I did not fill this up, so there are some which I do not agree, but I think it was done in that context at that time. But if you look at the no here, the National Identification Management System, the answer was no. So, but everything else we answered yes at that time. But a lot of it was still in pilot state or very limited implementation, and not really a nationwide implementation. Telehealth, yes, we had teleradiology, teledermatology at that time, but not telepathology or telepsychiatry, but we had teleneurosurgery also. And remote patient monitoring wasn't widely used in 2015. It was more of at the local level, and it was more of a pilot project. National EHR at that time in 2015 was very limited. So I think the country response was yes, but we did not really have legislation to govern the use of the EHR system. And then we had it in primary, secondary, and tertiary. But my thinking that the person who answered this was focusing more on a HIS system rather than the electronic health record systems. Back then, we had a lab information system, but we did not have a nationwide pharmacy or PACS back then, but was very localized in certain hospitals. Electronic medical billing, yes, we had it, and also supply chain. But there was no answer for the human resource health information system. Use of e-learning in 2015, I think, was not really done widely in 2015, but today, yes, definitely. And also health professionals in service for medicine and dentistry, yes, we used e-learning. In terms of mHealth, if you see, there are some of it at the national level, and there was some that's done at the local level. For example, the management of disaster and emergencies and community mobilization and so forth was done at the national level. But if I had to do this again, the answer could have been different. But this was the answer that's already been published. But if you notice, even back then, we already had disease surveillance at the national level. But today, with the pandemic, I think this is very much a very crucial system. Social media, we had a strategy on using social media in 2015 already, and but not really a specific policy or strategy. And use of social media was already extensive back then. Even today, it's much more extensive for strategic communication and also risk communication. And also in the pandemic, a lot of social media was used for individuals and communities in terms of health issues and so forth. But back then, it was already also being used. Big data, we already started our My Health Data, Malaysian Health Data Warehouse in 2013 itself. So we had governing the use of big data, and also but the governing of use of big data by private companies, the answer was yes, but I think in 2015, I don't agree with this answer, but it was yes. So basically, these are the 8 components that that's already been published. But I think what's important is, where are we today? This is where we are today. If you notice in this box here, we have some information, hospital systems, we have nationwide pharmacy systems, blood bank, we have a data warehouse. Of course, all the regulatory related systems are online for pharmacy, food safety, and all the councils. Malaysia uses extensively the use of social media. Online health services have been mushrooming since 2016. There are waves of 4IR that's happening, AI, genomics, blockchain, but not in a not in a huge scale, nationwide. It's more of a local thing. We have initiated our nationwide EMR and HIE platform. We have completed our 5G test bed and a lot of clinical trials also on the digital health projects. There are a lot of national policies that came up, especially this year, in terms of science, technology, innovation, and 4IR, and also the digital economy. A lot of digital health innovations happening with multi-sectoral public and private collaborations, and multiple COVID-19 digital solutions. But the challenges, there are many challenges that I would think in terms of, we still have multiple silo and fragmented systems. We are slow in scaling and rollout of systems. Many of our hospitals are still manual. Ministry of Health hospitals, about 30 to 35% has systems. And even clinics, only 10% have full systems. I think our analytic capabilities can be further improved. We have both public and private sector. So I think moving forward, integration is very important. We are constrained with integrated and coordinated care. A lot of service model disruptions with new technologies, especially platform providers for online services. There are many regulatory roadblocks in especially in healthcare innovation. Public expectation is rising, especially with pandemics. Everyone wants it online. And what would we do with the pandemic digital solution? I think this is what another thing that we really need to answer in terms of sustainability and repurpose. So if you have noticed what we did in 2015 and today, where are we today, I think we have gone quite far for the last 5 years. And I can see for the next 5 years, a lot of things will happen, especially with the digital economy blueprint and also with the 4IR policy. But this would be my advice, my thinking. If what when if I am asked a question, what the countries should focus on, I will still go back to our AeHIN gaps framework, which we did in 2015, which I think is very important for countries to work on these four important fundamental topics, which is governance, architecture, standards, and interoperability and program management, or gaps. And these are the areas that I think we really need to strengthen in moving forward in digital health. So with that, I think, thank you. So back to you, Alvin.
Thank you, Dr. Fazila. So, as I mentioned, Dr. Fazila, before we started, we would like to know, do you think the current framework that was given in 2015, would it be applicable for 2021 moving forward?
You mean the survey?
Yes.
No.
Uh-huh.
In fact, when they showed us when we had the meeting with the ASEAN eHealth group, which is newly formed, we have not had, we have had all the preparatory meetings. When it was shown to us, we think that it has to be reviewed, and there are a lot of things that have is happening today in 2021, especially in the post-pandemic era. So I think that survey really needs to be reviewed, and you cannot use that anymore. Yeah.
Okay. One of the first things we learned about Malaysia around that when around 2000 2001 was your uh, lifelong Malaysian.
Lifetime
Yes.
health record.
Yes. Is that still valid and will it still
Okay.
be?
Right. In fact, we in Malaysia, we envisioned this was already in 1997. We had a telemedicine blueprint
Yes.
where we projected what will happen in 2020. And at that time, we were already talking about lifetime health plan and electronic health record and so forth. But the implementation did not, the strategy was very good. The vision was
Mm-hmm.
very far-sighted, but the technology was not ready at that time.
Mm-hmm.
So we started some pilots, but in 2003 we terminated it, and then we reviewed again in 2009, and we had a very small kind of EHR project, and but that is also didn't go far. So but today I think we are moving forward with a nationwide EMR and to create our own HIE platform. Yes, in the last 2-3 years we have been attempting it, and hopefully this year it will take it off. Yeah.
That's still consistent with the lifelong
Yeah,
Malaysian.
we are consistent. We want to make sure that all people, every individual in Malaysia has a lifetime health record from birth to death.
Okay. So Dr. Bunchai, please open your microphone and ask your question while I'm reading the other questions. Go ahead, Dr. Bunchai.
Dr. Fasila, you said that when you have a preparation for the ASEAN eHealth group, they present the framework or something like that. They who are they? Who are they?
Who presented this?
Yeah.
You mean the survey? The WHO.
WHO Wipro or Zero?
No, HQ.
Okay.
The digital health and innovation department.
Marine?
Yeah, yes.
Is that Marine? Yeah.
Yeah. He came. Yeah.
That what I said, that it kind of the missing in headquarters and the regional. That is my frank evaluation for the WHO. You can see that you mentioned about the WHO ITU strategy to keep in 2012. I involved in the GOE, Global Observatory for eHealth, in the second round of the survey in 2009.
Okay.
I think the first one in 2005, when they have the resolution in 2005 to use ICT. So the framework is kind of the similar, but in the 2009 they do they modify the frameworks and the tools. And then, to my knowledge, that when we have the second and third AeHIN GM in Manila, the person who responsible for GOE also came to our GM and try to promote that. I asked a very difficult question for him, that did you work with the WHO ITU strategy toolkits? The answer is quite ambiguous. It seemed like, oh, we are different department or division or something like that. And I think in 2013, they do selected countries. So if you go back and see the report, you can see that they have some report related to the eHealth, but not the full-blown. And then in 2015, I think that might be the complete third round or the fourth round of that. And the framework have been modified.
Yeah.
They haven't mentioned about the 7 component in WHO ITU toolkits. You can see that the framework is quite different. The framework in the GOE is more on the application. Like if you compare that with the WHO ITU, it's more on the service and application. They're talking a little bit about funding, about infrastructure, but not kind of the explicit or the elaborate the 7 components. And at the same time, if you remember that one NGO, I forgot her name, developing global digital index, which follow the 7, that 7, and they still have their website over there. So you can see that there is several frameworks or several survey tools. And then I think they have another consultant recently, and they try to develop, they call the dynamic, sustainable, digital health maturation model.
Yeah, but
and I think
this is already focusing on the 2015 and to further improve the digital maturity model, I think.
Okay, I haven't looked into the detail, but it seemed like I saw their presentation and framework. It's very confusing to me. That they try to mix and match.
We'll try to get a session on that. I think they're finalizing, and then in the first week of June, they will present it to ASEAN.
Okay. Then, we are having our meeting. This TWG eHealth ASEAN was just formed, and we had our first meeting in January just to prepare for the big meeting, which will be third quarter of the year.
I just try to give you the history, and then we as ASEAN group, we should be
Yeah.
kind of aware of this
Correct.
and be. I'm not opposed to any things, but I think it should be benefit to us. Otherwise, if one group
Yeah.
creates survey and then throw up to us, and you remember that just recently we have to do the score survey, which is almost all about data, which is in another division.
Yes.
You know, that is the mess.
Yeah.
To me, I think that they have to harmonizing those or integrate. They say that we should harmonize in country, but they don't harmonize.
Actually,
I wonder whether WHO is on this call. No, they are not.
it's okay. I think and we're here. I mean, you're presenting tonight. Dr. Bunchai presented last night. Dr. Tep is here, and then the Philippine team is also here. I think that to me, what Dr. Bunchai is saying is when you do a survey, it's because you want to know where you are and where you want to go.
Yeah.
And I think the surveys are very important because if you keep on changing the survey, the countries will also get confused. What happened to the last one? Did they actually look at the result of the last one and they change their strategy, or did they enhance their strategy because of what they learned from the 2015 assessment? So that was actually my next question to everyone in the call. In looking at your 2015 assessment, what did you actually change your strategy? But before you answer that question, there's an important question from Dr. Thep, which I think is very practical because they just finished their convergence workshop. And one of the output there and one of the recommendations of the technical experts from the international group is that there should be a digital health program management office. And Malaysia is one of the, there's a question here for you, Dr. Fazila. How many people do you have in your PMO? And we'll also ask Aliyah and May later on, PMO for the Philippines.
Actually, we don't really have a specific unit called a project management office because we have so many divisions in Ministry of Health. So and we have one ICT division, the main one that coordinates all the project. So it goes by project. So there's no project management office, but it's centrally coordinated by the ICT division. And every division has also some ICT officers. But for example, the EMR project that I am doing right now, which we are going to go in for a competitive bidding in third quarter, we have created an entity called the Central Design Office. So in there, we have about 45 people, but they are not full-time. They represent all division, but we come together for meetings and discussion towards a single goal of doing the project. So there's no specific project management office.
You have a structure where you have a system that brings these different people from the different
together groups. Yes, correct. Yeah. And for every project, we have a 3-tier governing structure. This is mandated by the Central ICT Division of the Prime Minister's Department. So we will have the project team, we have the technical committee, and we have the steering committee. So it's a 3-tier governance structure for every ICT project above a certain amount.
Okay, thank you. From May, good evening, Dr. Fazila. If you can recommend at least 3 specific eHealth components or digital health aspects for the upcoming eHealth survey to set the ASEAN baseline, what would it be? Because you answered that the 2015 assessment won't work for 2021. So what might be 3 things that you might be expecting in the new framework?
I think I think what's very important is governance. We really need to strengthen governance. So questions about governance must come up in that. So in that, governance will also include policies and regulations. Another important thing will be standards for interoperability. I think if we go back to the gaps, these are some of the components which I think will be the important components of the next survey, and also capacity building. capacity building is also another important thing I will think. But you know, in now in 2021, we are already talking about 4IR. We are talking about emerging technologies. So, but all that will also require new regulations and new policies. So I think these are some of the new things moving forward in the coming survey that they should address. So actually, a lot of it will still go back to governance.
Okay. So governance is a constant.
I think it's a very important, yeah.
Mhm. May you can answer the question of Dr. Tep also in the chat window. Um, if you had unlimited funding for the next 5 years, Dr. Fazila, where
Unlimited or limited?
un unlimited funding. If budget was not a problem, either government becomes very generous or they tell you, just tell us what you need. What would be that one thing that you will ask? With that, how will you use that support, that investment support? It's a
I,
theoretical question, but
okay, yeah. I will put systems in all my hospitals and clinic. The front end. I think the front end systems is very important. A lot of our focus back in those years was on HMIS, on collecting data, you know, for statistics purpose and so forth. But I think if I had money, I will make sure all my hospitals and all my clinics have some systems, some patient management, some billing systems, you know, EMR, and that will be my focus. Yeah.
now, Malaysia is also, this is a special question for you because amongst the countries in the call, you are the one who's a member of SNOMED. So
Okay.
how would you, I know it's been a challenge, but
It's a huge challenge, yeah.
but would you rather have it or none? I mean, you already have it. So is it just a matter of time to get it done or
You know, it's a very difficult question.
Mhm.
And actually, snowman, if you see the use is there, you know. But I think the difficult part was you have to create their own reference sets. And you know, to get people to do it it's quite difficult.
Mhm.
But the use of it is there. We can see it, and so we have created references for cardiology services, for dentists, dental services, and also now we are doing for the traditional and complementary medicine. But after looking at ICD 11, we I don't know whether the relevance of Snowmed City there. Yeah.
So it's specialty driven. If the specialty wants to create their ref set, then they can get it from a pool like SNOMED.
Yes, correct. Yeah. So, but it's to get the people and to sustain this ref set. It's I think it's a tough job.
But at least there's a box that they can get this
Yes, correct. Yeah.
we don't need
Yeah.
to imagine and invent.
Yeah.
And in the Philippines, we're looking at ICD 11 first. If it's
No, no, in fact, it's good. We are also now already looking into ICD 11 and we are already going to implement it. But right now we're going to implement it back end at our HMIS. So the hospitals will still use ICD 10, but when it comes to back end, it will be mapped to ICD 11. But in the new EMR project, which I am doing, we have already included ICD 11. So hopefully in 2 or 3 years time, it will be at the front end. Yeah.
question from Anthony is the FIRE standard or other interoperability standards being utilized in Malaysia?
Okay, for the coming project, my nationwide EMR and also the HIE project, it has to be on fire standards. Yeah.
Okay, good. And then there's a question, other parts of the region, maybe Dr. Bunchai for Thailand and
Yeah.
May for Philippines.
Philippines is here. Laos is
Dr.
also
Bunchai,
there.
FIRE
Fire.
in Thailand.
We are also promoting FIRE, and we have the standard and interoperability lab Thailand. Try to which composed of it's more on informal group. Try to learn about the FIRE and find some projects to do the to implement use case, and it seemed like two use cases already everyone are interested in is the health information exchange between health facilities and primary care, which is try to implement the information exchange between the clinics, health center with the hospitals, and we promoting that, and it seems like people aware of that. In terms of the real world, the real things that work, it haven't been done. It haven't been in the real, but it kind of the gaining, learning knowledge, getting people to agree on the same direction, and it seems like to kind of the creating awareness. It quite success. Maybe because of the global trend of the fire also leading to everyone when they go and search for information, they saw fire. Even they don't know exactly what fire is, which is not simple as it be. So I would like to respond to the previous comment about the ICD-10 SNOMED cities, ICD-11. I am as a terminologist who work on the standard. To me, I think this is the wall, the terminology and code classification wall between the SNOMED CT International and the WHO ICD-11. It's tug of war between the two, and both of them have benefit and disadvantage and weakness, has a strength and weakness. To me, as a person who are going to implement, ICD-11 cannot reach to the level of the granularity of to use the clinical use. And if you want to reach that level to be the front end, the learning curve or steep is similar to learning SNOMED CT. Because of if you go deeper, there is two layers of the ICD-11. One layer is the mortality, morbidity table, which is more the classification side. And then the terminology that they claim that it can serve the front end. That is another one that is complex and very new. Similar to SNOMED, but less granularities.
So there is less expressiveness.
Yes. And another point that Dr. Fasila said, okay, we will do SNOMED, we will do ICD-11 at the back end. Front end may be 10 and back. That would be very challenging. In terms of if you want the clinical front end of the clinical level to be more expressive. ICD-10, we know that it's not expressive. So it's more the group of the disease. You can map back to the ICD-11 in the classification level. That is okay because of it kind of the another version of the classification. But to map back, to map into the second layer, which is the terminology or ontology, it is not possible because of the ICD-10 is classification, which is more aggregate than the terminology. Mm-hmm. To me, it has to be free. You have to, if you decide to implement ICD-11, which is I think might be suitable for lower middle income country. We have very less capacity on the terminologies and informatics to use ICD-11 and WHO supporting that. That might be good that we can implement it in the front end. But remember, it would be very not expensive as the European, Canada, North America that they use the SNOMED CT. To me, I think this is the two things that we cannot avoid. I'm this is my very assessment about the ICD-11. They because of they hold the normative. WHO hold the normative position, and they want statistic to kind of the continue at a whole cohort.
Right.
So the morbidity, mortality table cascading will be there, which is I think this is very important to compare. But the ICD-11 to reach to the level of implement into the front end as the clinical as the terminology is very challenging for them.
Yeah.
That's what my assessment.
The way I explain it to my students is that it's like, brush and comb. The brush is like ICD-11. You have a lot of bristles, but they are far apart. And then the comb is very fine tooth, and it will have very close terms to each other. So you can have more expressions and more ability to express in SNOMED than ICD-11. So to summarize the answer to the question, FIRE is going to be part of the national EHR plan of Malaysia, and FIRE is in the laboratory in Thailand. And I think FIRE is now in the back end in the Philippines. They're using FIRE to collect some routine data for COVID-19. Correct me if I'm wrong, May in the mic or in the chat window. Now,
I think I can mention that people thinking that FIRE is just the format and be back end. To me, I think FIRE composed of three of the standard layer. Because of you have to have the semantic terminology coding standard, you have to be there. If you don't have those, then FIRE is just the web service. So you have to have those. And the another layer, I think Jürgen is over here too, is that the FIRE profile and FIRE the implementation guide, which is the use case. Like Dr. Fasila said that the reference set of the SNOMED is part of the implementation guide of the FIRE. So the FIRE is just use the web technology with the current. You have no choice. You have to have the semantic. FIRE try to create some semantic in their FIRE, but not all. You can do that by using local terminology. But if you use local terminology to reference with web service in your country, then you cannot talk to another country. So that's why the international semantic still
challenging
and it's really important.
Okay, Dr. Fasila from Anthony, might have missed it, but could you repeat the national EHR plan for Malaysia?
Oh, okay. The national EMR project is actually is to roll out the systems that we already been using in our primary care and also hospitals. And so we are doing a pilot in one state where it covers all the Ministry of Health hospitals and all the primary care setting, plus with the HIE platform, and it's actually to show integration, interoperability, coordinated care, vertical and also horizontal integration. So it will be done through a competitive bidding. The tender is supposed to be out in third quarter or fourth quarter this year. We have got all the approvals. It's just now awaiting for tender process. So it will be for 48 for 2 years, covering about almost 97 sites in one single state. With our new HIE platform based on AppFire, and also plus the rollout of the systems or the hospital the EMR systems.
Will there be a diversity of EMR systems? Or
no. For this, it will be our system that we already used and the one that ministry have been using. So and also the primary care systems. So in this is where it will also include some of the upgrade, which will include ICD-11 in the diagnosis and so forth. So that is why I said that it'll take about 2 years because it is embedded into the system. So while waiting for this to come up, the ICD-11 is done at back end at the HMIS level. So hopefully, once this is a project is up and going live, once it's gone live, then we will look into a nationwide rollout. But it has to be a sustainable business model, you know. So we are looking into other form of scaling up, like a public-private partnership. So that is the national EMR project.
That's a very big project.
It's a huge project, yes.
And then after, so it's in one part of Malaysia.
One state. We have 14 states in Malaysia. So it'll be in one state covering all the primary care clinics and also the hospitals of the Ministry of Health.
So you're doing a network approach in that state.
Yeah, in that one state.
Service delivery network, pouring in all of the resources rather than separate investments in all of the states, but patchy.
No, we already have all these patchy ones. So now we are trying to prove integration and interoperability.
Right. Okay. So in this one state, so your approach before, since the 1997, has been patchy. So now you're going to try to have this integrated service delivery network in one state. Make it work.
Make it work. If it works, then we'll do a nationwide.
And then you have the HL7 Fire as the backbone, connecting all of these different patches.
Yes.
Dr. Bunchay?
May I ask Dr. Fasila that for that one state that you said integrated services, how about the EMR? Are you going to use the only one EMR? Or you said, okay, we will use the standard like Fire, and then any vendor that have this kind of develop the EMR for the 90-something site, you have to comply with this standard, and then you can bid for
for this pilot, we'll only use the one EMR for the hospitals and another one for the clinics. All right, the one that we already used for is which is owned by Ministry of Health, because our objective is more to show the integration and interoperability and the HIE. But when we are going nationwide, it may be open, you know, and also to fill the gap. The systems that we have may not be complete. So to fill the gaps, you still need third-party systems.
How many hospitals in that state?
We have seven hospitals and almost 100 over primary care clinics.
Okay, so 7 hospitals will use the same EMR vendor.
Yeah.
Okay.
And, same system, not vendor. Same system. Yeah.
Okay. Same, like the Cerner or the all script or something like that. Right?
Yes.
No branch. Okay, there's a question from Yani. What are the problems in implementation of eHealth in Malaysia? And how is the government support to that? So first part is, what are your challenges?
I've put up the challenges earlier in my slides. You know, we have a lot of challenges, but if you break it up in terms of people, process, technology, is the common challenges that everyone has. But what I am also thinking is, you know, in moving forward, the challenges of yesterday and today will always be there. But I think what's important is what is the challenges of tomorrow. I think the challenges, there'll be new legal issues, ethical issues, especially in the use of AI and so forth. And also a lot of challenges in terms of data governance, data stewardship, and then challenges in terms of platforms. You know, moving forward, it is the platform economy. You know, we're using online health services. What about the platform accountability? So these are some of the things, and the skills, upskilling new skills for our healthcare workers, our healthcare providers. It is also a challenges. So I think if you break it up, people, process, technology, and also new challenges, this is what we are facing today.
Irina is asking if you can share a high-level architecture of the integration project. Do you have that? Do you have that somewhere easy accessible? Well,
Um,
I'll ask Dr. Bunchay to, or
uh,
is that shareable or?
I, no, yeah, right now I don't have it. Yeah, yeah,
All right,
yeah,
Irina, maybe
yeah, yeah,
offline we can ask that
yeah, correct.
side. Okay, so now I think fire is emerging. There's just different levels of what do I call this traction. In Dr. Fazila's side of town, they're making it, you know, the interoperability for all of the different patches that they already have invested on. So they're asking these patches to now connect to each other using the HL7 Fire platform. In Dr. Bunchay, they put up a lab. So now in that lab, they're showing some use cases, and then they'll start pulling in the stakeholders, definitely Ministry of Health, to show some, you know, this is how fire works. In the Philippines, in the chat, they're using it for COVID-19 information system. Um, I think from the case management perspective. Other countries, any questions?
I think I would like for the participant who would like to ask or comment, just unmute your mind and
Yeah.
then just give the comments.
Yes. It's a very small group, so just open your microphone and then I will just manage if we all open it at the same time. Jason, you want to say something, or Jürgen or Jovita?
Uh, there was a question about the challenges,
Hmm.
and I was talking about some of the new challenges I think all countries must start looking at. Can I just quickly just share two slides?
Sure, yeah. Go
Just
ahead.
two slides.
Got
Yeah,
5 minutes.
5 minutes. Yeah. Can you see the slide?
Yeah.
So these are the challenges actually. I've put it up, but like I told you, these are the challenges of yesterday and today in terms of policies, infrastructure. These challenges, I think every country has the same, in terms of systems, financial challenges, people issues, change management skills and so forth. But this is what I did. These are the new challenges which actually, if you really look at it, there are a lot of new things that we must start thinking of, in terms of new business model, platform governance. There must be new reimbursement models because the care models will change, and then in terms of emerging technologies, issue of liability, indemnity, ethical issues, social inequality, foresight policies are very important. What about the future of work and digital skills? And of course, all other challenges in terms of bias algorithm, clinical validation, software as a medical device, also, and then issues on data residency, data governance, issue of social media use in clinical and public health,
Mm-hmm.
issues of digital right of patients,
Mm-hmm.
digital trust. What about bringing your own device? And how are we addressing digital divide and digital equity? So these are the things that these are new challenges, which I think sooner or later all countries will need to address this. So basically, that's what I meant by new challenges.
That's a lot.
Yeah.
For every bullet, if you want to assign a person there, you need 30 people.
You don't have to assign every person.
Yeah. So how do you engage the universities? To
We
support your work.
because in a lot of our work, in terms of so there's a lot of collaborations we do with other agencies, government agencies, and also universities. But I think there's a new policy about the triple helix and the quadruple helix kind of work, where government, private sector, and university come together, and then lastly the civil society and the people themselves. So these are the new things that we are looking at when we are doing any projects, mainly in the areas of healthcare innovation.
Okay. Thank you very much.
I think, Doctor, there is one question about from Anthony, that is telemedicine being reimbursed in Malaysia now?
No.
What is the regulation for SAMD? I don't know the SAMD.
Yeah, software as a medical device. Yeah, we don't have that, but I think many countries have already started, and we are looking into if coming up with that regulation. Right now, telemedicine is not reimbursed in Malaysia right now. Yeah, yeah, but I think slowly private sectors are already doing it, and one or two insurance company are already paying for remote consultations, teleconsultation, and so forth. Yeah.
Okay, so thank you very much, Dr. Fazila. A big hand, please. Thank you.
May I have a last
Yes.
question for Dr.
Yes.
Fasila?
Okay, go ahead.
Yeah. I think if you remember, we have a champion from Brunei. I don't forget that gentleman. But when we went to study tour in Japan together, and how Brunei active in is there active in the eHealth ASEAN eHealth group, because of
Yes.
they implement one system the whole countries.
Yeah, they have single system for the whole country, and I think you're talking about Po Seng Chong. Yeah, I think he has retired, if I'm not mistaken. He's no more, but Brunei is involved in that. All 10 member states are involved in that ASEAN country. Yeah, but these are more new people. So, but I met them. Correct. They're still having the single system.
Okay. Thank you very much, Dr. Bunchay, Dr. Fazila. I will see all of you again tomorrow night to continue our discussion. Our presenter is Indonesia, Dr. Anis Fuad.
All
Good
right.
night, everyone. Take care.
Good night. Thank you.
The recording.
Bye.
Thank you. Bye-bye.